I am excited to welcome again Becky Harmon with us. She was with us last night for our family leaders training, which is available in a recording right now and then will be put on YouTube. We had a great discussion last night. Becky is from the National Family Association for the Deaf and Blind. And we also had participating in that conversation, Derek Robertson from the Sickle Cell Disease Association of America. And there were a lot of conversations and questions that we had that we felt would be great for our learning community today. I saw that Kathy had a question about the poll. I believe there should be a link where you can hit poll and it'll bring it back up again. The pre-poll stays up there. And then I will put another poll up after the presentation. If you have any questions, comments, everybody is able to talk. So you are able to unmute yourself as we go along. Today, we're just going to do a review of some of the things that we discussed last night. And I think, Becky, we can show the video. That'll give like just a great jumping off point for questions. And then it's really a conversation and questions about this transition. So we're excited to have that conversation. Becky, do you want to talk about what we talked about last night?
Okay, hi everybody. Becky Harmon, and I apologize for the background. I have an attendant, I hope, is coming in the back door and the dog is alerting. So maybe they'll calm down a little bit. But my special needs daughter is going to be going bowling. So bye. Hopefully sooner than later. So last night we had a great discussion. And Derek, I'm so glad that you're able to make it again, because I think it's so nice to have a dad involved, you know, that has been through it, and you've got so much to bring to the table. And so it was a great discussion. You know, so many times we have so many females involved, but not very many dads. So it's great to get your perspective of it too. So, and I need to get your contact information so we can share with them too. So we'll do that later. But so anyway, I'm talking from Lubbock, Texas. So I apologize for my accent. And so I'm kind of nasally today. So I'm hoping it'll be okay. But just let me know if you can't hear me or understand me. So we have a wonderful resource that everybody needs to know about. And we wish we would have had it a long time ago, because my daughter is 28, deafblind with multiple disabilities. And we really could have used the help then, because you manage all the other things you think you're taking care of, but all of a sudden here you go, what? She's 18 and she can't go to that doctor? Or like we mentioned yesterday, can't go to that dentist? And I think it was Jaleesa said, or no, not Jaleesa, it was Tina who said, you know, they erased everything. So she can explain it, but it was on last night as well. But just amazing things that you go, what in the world? Why can't you even tell us, you know, that something is about to happen so dramatic to us? So what is healthcare transition, or HCT? All of this has been done from funding from the U.S. Department of Health and Human Services. So this is all good stuff. We're hoping to get it into more of the business side of the hospitals and things like that as well, even with families. So you can hear my daughter. Deaf kids, if you don't know that, are the loudest kids you'll ever hear. I mean, they are not quiet at all. So anyway, so healthcare transition is to improve, like the word yesterday is empower the youth to be able to take care of their own healthcare. Once they turn 18, they're not going to be able to have parents go in with them. And you were just pretty much cut off. All right. If you have a special needs child, you better be ready for guardianship or something close to that. That's another type of planning that you guys might want to look into, as well as guardianship, or, you know, having a legally authorized representative, LAR. So, because that is important in this. They will not talk to you after they turn 18. And I'm talking about the parents and the caregivers. So you need to make sure that you're prepared for that. But the other part of healthcare transition is trying to get that clinical process of pediatric to adult practices headed in the right direction. And so this is why Got Transition was all put together. Again, it leads to health. In the next slide, health, patient experience, and utilization of care. So hopefully it makes it better. It improves those kind of things. If they do have special health care needs, they have a structured HCT process called the 6 core elements of HCT. So what does this healthcare mean? What does HCT mean to you? The toolkit was made up of, or has been created by Got Transition, but National Family Advisory Group, which Derek and I are a part of. Derek is representing the nationally, the Sickle Cell Disease Association of America, and I'm representing the National Family Association of Deafblind. So there's lots more people involved in trying to get all this done. We pretty much just gave our input, and then we're going out and preaching what we found, and that sharing everything that we know about it and trying to make it better. So if you have questions, we can take them back to the whole team and we can share with them. And one of the things we mentioned yesterday was foster care, transitioning, because once they get out of the system, they're on their own and they have no family unit to help support them. So we need to hone in on that and try to get that taken care of as well. So the next one is, oh yes, ready for the video. Yeah, here's a good video that demonstrates everything on it. So let's take a minute and listen to this.
For many young adults, transitioning to adulthood can mean going to college, finding a job, or moving out on your own. This can be exciting, but also really challenging. One transition that you may not have thought about is healthcare transition, or HCT, which means moving to an adult model of care where you are the main person in charge of your health. HCT is not a single event. It's a process that can take several years. Learning about your own medical history is the first important step. So ask your doctor how to access your health information. A major part of HCT is learning to manage your own health and healthcare. To start, you can make your own doctor's appointments, fill your own prescriptions, and talk with your doctor alone. After you turn 18, your doctor can only legally talk to you about your health. Your health information and medical records will be kept confidential. It is up to you to make your own health choices. You can decide, for example, if you want your parents to see your records or be in the doctor's appointment with you. For those who see a pediatrician, HCT also means moving from your pediatrician to an adult doctor. This usually happens between the ages of 18 and 22. Some people see a family physician or a doctor who sees patients throughout their life. If you see a family physician, you'll need to change who makes your health decisions, but not your doctor. In an adult model of care, you, and not your parents or caregivers, are in charge of making decisions about your own health. To plan for this transition, talk to your doctor and ask them about their policies. If you see a pediatrician, ask them when you need to leave their practice. You can also ask them to help you find a new adult doctor to move to. HCT is all about independence and empowerment, so be proactive. Find an adult doctor who is accepting young adults into their practice and takes your insurance. And don't forget to encourage your friends to be proactive about their healthcare transition too. For tips and resources to make your healthcare transition as smooth as possible, go to gottransition.org.
Yeah, that video is really good to just describe the basic thing of what we're talking about. One thing that they mentioned is the family physician, and that is like a primary care physician, PCP. So if you could get one of those that does the family care, you have a little bit less worry as far as trying to navigate the system and find a new doctor somewhere else. And so, you know, that's an awesome thing to do if you can find somebody like that, a family physician that treats the whole family. Not that you have to all go, but, you know, they're a little bit more from pediatrics all the way to adults. So on the next slide, yeah, let's see, I'm losing it on my iPad here. Sorry, I have to blow it up so I can see it. Okay, so we've got, this is where I mentioned we have the different family advisory group that Derek and I are on. And in the next slide, we've got questions that can be asked. And we'll just slide in 2 more slides. When should my child and I start to think and talk about transition? And it gives you a timeline. And you'll be surprised in the next one that age 12 is when they suggest it. And I know we mentioned it yesterday that, wow, that seems young, but time flies when you're having fun. So if you don't start early, you're going to be just trying to pick up and catch up. So, and we mentioned how important it was for every year to be looking through this and see where you're at and try to figure out how is your child proceeding. You know, are they able to make better decisions as you go along? Are they going to need more help? So as you look through that, you can see how you just gradually increase their responsibilities if you can. And if not, then you need to pick up this slack and see where you need to change it. You know, either get them on board with it or try to figure out how you can manage to help them. Because it does go through age 25, but like we were saying in the meeting last night, sometimes at 18, they shut you off and you don't have a choice. And so it's better to take care of things beforehand if you can. Now, you guys chime in if you have a question about anything. So clinical recommendations for HCT, what are the recommendations? They talk about this parent guide. And so, of course, we're not going to read the whole thing for you, but everything you need is in this PowerPoint embedded in. So you can click on the links and everything to give you more information if you need it. But this is just a parent guide to help you about that. The next question is questions to ask your doctor. And this is where we mentioned that you go through a progressive stage. So for the parents and the caregivers, during your child's adolescent years, you might say, well, ask, what age does my child need to change to a new doctor for adult health care? Well, we can pretty much tell you at 18, but there are some hospitals and some doctors that allow the kids to go through, you know, maybe 25. But I know person's neurologist said, nope, 18, you need to find a new doctor. And I'm like, because that was really traumatic trying to find somebody who can manage somebody who is deafblind. You know, it's not like you can just go and find anybody. So everybody has their own individual issues and concerns. And so, you know, if they're one that's a little bit more needy, you need to step it up. So
Becky,
yes.
can we just ask some questions in here?
Yeah.
So last night we were talking about some of our own experiences with transitioning, and some, were negative and some were positive. Just wanted to ask the participants today, about their experiences. Do you remember when you transitioned from pediatric care to adult care? Were there any challenges you faced? Or if you have already transitioned some of your children in this. I know last night I had talked about how this isn't just a concern for, your primary care doctor, but my daughter has recently turned 18, and she was dropped by her pediatric dentist. And by dropped, I mean they erased her information. She's disappeared from their system. So, I wish I had known about some of this beforehand, so we could have gotten her records, transferred them, and done a slower approach. And instead of now scrambling, her pediatrician is letting us have some time to transition. And, so I think that's great. But if I called, tomorrow, and they said, well, if I call tomorrow, they're going to say I can't talk to you, which we talked about last night as well. So does anybody here, any of our family members or professionals, have an experience they would like to share about their transition or their children's? And you should be able to unmute, but if you can't, just let me know.
Hi, my name's Kathy.
Hi, Kathy.
I'm finding that the HIPAA thing, we talked about that yesterday. I've been trying my son's 19, so I've been trying for a while to have him give me access to his information. Because a lot of times our insurance isn't the greatest, and there are a lot of challenges with the financial end, and a lot of the medical people won't let me talk about anything unless he's signed off, that he's giving me access. And I think part of the problem is he had engaged in risky behaviors in the past, and I think he thinks that giving me access maybe I will go dig into his files and see what he's up to. So I actually looked at some HIPAA regulations this morning, and it's very, very complicated. Some states give extra protections for this and that, but it would probably take a semester-long class to delve into all of it. So that's it. Thank you.
That's a good point, Kathy. I think there's probably they can fill out to say, the child can fill out and say, I want so-and-so with me, or I want anybody that I write down on a piece of paper that I want them to have access, and leave messages, things like that. They should always have a form to fill out similar to that. So you have to manage and go through and look at every single thing. But as long as the person, your child can take care of that,
can everybody hear me?
Yes.
I can hear you, but I can't hear Becky.
Yeah, she must have frozen.
Yes, I'll just chime in and say, I think the permission things can be challenging. I think it really does start, and that's why transition really is a process, right? Because it really starts with a conversation with the young adult, so that they can understand what they want to disclose and not disclose. As Kathy pointed out, sometimes they don't want you to know everything, and there are certain things that can be protected. It's usually around, as Kathy said, specific behaviors, a lot of times related to sexual health and stuff like that they can protect separately. And so in that discussion, you can say, okay, no, I just want access to be able to, make appointments or get test results or, something along those lines, and could be specific. It doesn't always have to be a broad permission. It could be a permission for a specific conversation as well. Interestingly, as we might know, there's an exception for payment. So insurance companies are very willing to share with you how much somebody owes, because they can do that without requiring any sort of HIPAA compliance. So payment is an exception to HIPAA, anything to do with the payment of a claim. So they're going to get their payment or, without having to worry about that. But I think the important thing is to have that conversation and with the provider as well, to establish that permission. And as we were saying last night as well, it goes beyond just healthcare, because you have to remember that some of these protections, if your child is going off to college, and I was making a joke last night that, the FERPA laws, which relate to education, they don't have to release their grades to you. I said, well, okay, if you don't tell me your grades, then you can pay for this college yourself, right? So, but it's not just healthcare, so you want to remember that as well. But have that conversation early, before they're 18, 16, 17. You're going to be turning 18 next year. If you don't agree to this, I won't be able to help you with certain things that you might need help with, and approach it that way.
Thank you.
So sorry, guys, lost my internet, but Derek, you did good. Picked it up.
Yeah, I mean, and some of the other things, other questions, that we talked about as well is, before I even get to those questions, in chronic illness, a lot of times there are a lot of comorbidities. So in sickle cell, it affects every organ of the body. So even though you're going to the hematologist, one of the things the adult hematologists find is that, the women may not be going to their OBGYN appointment, or male and female may not be going to their eye appointments. And so you have to make sure that the transition is beyond just the specialist. It's making sure, okay, no, all of a sudden they have to make an appointment with a nephrologist for their kidneys, or like I said, the ophthalmologist for their eyes. And all of this is something that you have to look at. And asking the questions beforehand is, how are treatments going to change as your child, is now an adult? And there's some medications, for example, that are only approved for adults. And so that might open up access to different treatments that you can get as an adult that you were not able to get as a child, or maybe something was being given off label before that. No, it's different. So those are the sort of things, knowing that it's not always just a child is not always just a mini adult. It really does change, and that's something to also have a discussion with your clinicians as well.
And we had a little discussion about advocacy too, and helping your child become their own advocates, and this starting early. So I believe one of you had said somebody had recommended like from birth, or from when the child can speak.
So
Derek,
yes.
yes.
Yeah, so this RN who works at Children's National, she's in charge of their transition program, and she always jokingly says, I start transition from the start to talk, and she's not being 100% serious, but what she's really making is that it's never too young. And I was saying that your child could be 6 years old, and you could look at that child and say, do you have anything to ask the doctor? And she might ask a question about baseball, who knows, but it's just getting them into that idea that they can ask questions, for themselves, and making sure that the provider talks to them directly, as they get a little bit older, 12, 13, 14, that they're not addressing you, and just engaging them in that office visit from a young age allows them to begin to see that, they can speak up and they are a part of this process. It's not just you and the doctor talking, they're sitting there on their phone, or they're just sitting there as if, hey, I'm not even present in the room. Make sure that they're engaged in their care from as young as you feel that they're able to be doing that. And I mean, I know there are no questions coming through, but I saw some of the introductions, and I know there are very experienced folks on this call who are in charge of transition clinics and stuff. So please chime in with your own experiences, because I know you have them, and share, because I think that's one of the things as well that we'll talk probably later, just in terms of sharing. I'll never forget, this is not a discussion about 504 plans, but that's involved in a little way. I learned that from another parent, so just being able to talk amongst ourselves, I think, is just so important. So please chime in with just your experiences and thoughts. We'd really appreciate that.
One of the other things we mentioned was asking other parents. If you can network with other parents, kind of like what you're doing today. We have maybe more specialists on here today, but people, well, maybe try to share somebody's note, to see if they could talk to them, or the video. There's a lot of different things you can help out with as well. I was looking at the second one on this before transferring to a new adult doctor. Do you have any suggestions? You would ask the adult for adult doctors. I do remember sometimes I can't remember exactly which place, it may have been the primary physician, giving a list of doctors that you could try, because they don't want one person only. They want to give you a wide range that you can choose from. So maybe if they had a list of doctors that were open to accepting new patients, that might help as well. So, you might even ask the nurses, because sometimes the doctors are fixated on at that patient time and going through, but the nurse is there to help with the transitioning and with anything that the client needs differently. So maybe they could get together a list of things, like the dentist. Tina, if they would have just had a list of dentists you could even try to go to, they could have it set up to send the records to them. It's just crazy that particular dental group decided to shut them off. That's very poor, if you ask me. But anyway, so
Becky,
yes.
I saw Lauren, did you come off mute?
Yeah, I just wanted to share something that we do in our clinic. So we see patients at Nemours Children's Health starting at pretty much double digits, so pretty much 10 and up, to help them through this process, because it is a lot. It is very stressful. And one of the things that our doctor does, so we see patients it's myself, I'm the social worker, and the doctor, we see them together. One of the things the doctor works on after the appointment is creating a portable summary that they can give to a new provider. And really a lot of this guidance is from Got Transition, and we use their resources all the time.
Right.
But she makes these very complex patients, she makes this summary of all their last specialty appointments, a summary of all the things about them. So people really come out of our appointments with a nice compact thing that they can hand to new providers to get to know them in a snapshot. And I think that's one of the most valuable things that we provide, besides, all the supports and the recommendations. And, of course, I talk about all the decision-making stuff that's, specific to Delaware or Pennsylvania or New Jersey. We kind of see patients from the tri-state area. So just wanted to chime in with that.
That is
Lauren,
awesome
that's
because
actually, oh,
yeah,
Sorry,
it's right
Becky.
there at the bottom, you know, the medical summary from the pediatric doctor, and we were talking about that yesterday. Bring with you a file folder or, you know, just a three ring notebook. You don't have to be big, but just having certain things, maybe a copy of all your insurance, your ID. We talked about you have to have an ID, you have to have your insurance card, and you have to have the money. You know, somehow, how are they going to get the money to pay for it? So, you know, those are things that you go to the doctor and they say, I need your ID. I'm like, put it on file. And they're like, well, we have to have it every time now. Well, you should have told it hasn't changed. You still have it in there. Are we going to see the doctor or not? You know, I mean, they need to update things, but they also need to tell us what they expect. So every time now, bring your ID, bring your insurance card, you know, have everything ready to go. So that medical summary would be something that you can even put on a phone as well. You put it under notes, copy and paste it under notes, have it in your email saved. But this is where you could also teach the person with the phone. So the adolescent that's going into it, you know, kids are getting phones earlier and earlier. So this is something too. They could also put their medical records actually on the phone, you know. So it's getting a lot more technology, but we also know you can bring the paper too. You don't have to just have a phone. So if you're not able to have anything else, you can have the paper stuff. And just have it handy on or keep it in the car. You know, you have to think about those kind of things beforehand. But I'm so glad to know, Lauren, that you're already using things from Got Transition, and that medical summary is awesome. So that is wonderful.
There's another really nice one pager that talks about turning 18 and what it means for your healthcare. And I make a folder for all my patients, and that's one of my resources that I put on there for my patients who are getting closer to 18. It's just such a handy one page. You can look at it at a glance and find out. And I also use the timeline. So yes, we're very much appreciating all your resources there.
Right, I know, it's wonderful having all this. Like we said, we wish we had them years ago.
And this intersects nicely with, we just did a training on the medical home and building a medical home for yourself, for your children, especially your children with special healthcare needs. But in that, we talked about a care notebook and creating a care notebook physically or electronically that has all of these records in one place and has additional items as well. So if you have, for example, children that are nonverbal, it would have their communication methods. It would have their special items that they need to function successfully. It would have, you know, how you should communicate with them, or etc. So it's not just the medical information, but that medical information is important because you can, as a parent, then give that information to your child as they become a teen or a young adult. Even if you're sharing you're doing supported decision making or guardianship, even if you're sharing that, having them basically take that over, that system, and be responsible for it, and therefore they know what's in their charts. They can put these one-page summaries in. They start taking over that responsibility. I said last night that I wish I had known about this earlier, because I would have started some of these processes with my older children as they were younger, and it would have given us more time to make them comfortable with some of these things. Because, you know, as an 18-year-old, when you suddenly realize you have to make appointments, you have to understand insurance, you know, it can be very overwhelming, especially children or teens and young adults with special healthcare needs. You know, they might need more time to process this. And I wanted to ask Lauren, or anybody, you know, how have you found your children, your teens or children that you have or work with how do they handle this transition? Because I know, for example, my son with autism, he is only 12, but he does not like changes. So even preparing him, we're going to have some challenges when he can't go to the doctor, the pediatrician that he's always gone to, or when he has to go to a different dentist. So, I'm glad that he's 12 and we have time to prepare, but just wanted to get some insight, not on the doctor end and paperwork, but in terms of the actual like emotions and helping your children accept that change as they transition.
Yeah, it's funny you said that, because I was gonna say that we have 90-minute appointments, and they're usually tissues involved, because a lot of times the patients get very tearful and overwhelmed. So especially if they come in for that first appointment and they're 18 and it's like, okay, boom, you have to start doing the stuff soon or now, and they don't have that time to adjust, it's a lot worse because the parents are overwhelmed, and the teens, especially, we see a lot of teens with autism, just very, like, sometimes they'll shut down. Sometimes it's just, we have to break things up into smaller chunks. Sometimes it's just something where we have the parents go home and start working with them, with some resources. But we even have had college students who are medically complex, who are very overwhelmed at the things that we're starting to ask them to think about in terms of their own medical care. Let's say, for example, we had someone who needed to start changing their own G-tube because she was going to be away. And what if the G-tube fell out? So she'd at least learn how to. And she was absolutely distraught by that prospect. And it just took a lot of like encouragement, and it was a work in progress. But, nobody really loves change typically. And for people with special healthcare needs, or if you have some, something else going on there, it could be even worse. Like autism, of course, people love the routines. It's really hard. But I think the key, like you said, Tina, is starting young, and starting, what we advise is starting small, starting with small things, like Derek had said. Start with that question, start with getting them involved. The sooner you can start, the better, and it'll just be more gradual and less painful for everybody.
Lauren, you said something really great that we talked about last night, was sometimes you have a patient or kids that come in that are right on the cusp, right on that, like 18, 17, 18, 19. And we talked a little bit about this last night, because it's kind of like, what do you do then? Like, you are getting like flooded with information. And I had shared my experience. And, I was placed in kinship care and wasn't adopted by this family member. So when I turned 19, I got dropped out of the nest like a little delicate egg. And it was like, you don't have insurance anymore. You can't see these providers. We won't cover your medication. And Kathy mentioned like going through this a few times with children that have ADD and ADHD. And it was like anything that I got at the end, I was just like immediately overwhelmed. I wasn't picking up the information, and I felt like truly lost to the very, very T of the word. Like, I didn't understand what was being put at me. Like, I just didn't get it. And so I think, if you guys mentioned a little bit earlier how we can do this for kids that have those complex, like medical needs, but also like kids that maybe don't have that family support to do this. And it's like, I love that we hear that the social workers at Nemours are pairing with doctors, and that's a really great model that I absolutely love. But it's, I think, also having these conversations and getting this like model out there. And, if social workers that are working, whether it's in like the medical side or more kind of like on the like family structure side, whether that be through the state or like private organizations, like getting this out to them so that when they have like a 17-year-old, 18-year-old kid that's about to transition out of care, but does have a complex medical need, like they're prepared. For me, I was just, again, like just so lost, and I had some really complex needs. And when I lost my insurance and didn't have like a way to transition, nobody explained that to me. I kind of just like left the medical system. And I personally kind of bounced around through, and we talked about this a little bit yesterday, but I would show up like in the ER, or I would show up at like urgent care. And so I didn't have a consistent team of people that were supporting my medical needs. I was, getting samples of prescriptions where I could for a practitioner that would see me until like I couldn't pay them anymore. And so it was one of those things where it's like, wow, having something like this would have, I believe, like really legitimately changed my life. And I know that that sounds like a very like weighty ask of like, some materials that have been put together, but it's really something like we recognize that there are a lot of kids and families out there that their social determinants of health are really a big hurdle for them. And for me, having something like this would have changed a lot. And now I'm like, okay, as a parent of my own child, I can go through this and be like, oh, these are things I need to think of. And it really helps me ask those questions of my practitioners for my child now, because these are some things that I didn't experience. And so having this and being able to share it is like, I think a lot of this stuff helps anyone being able to say like, hey, this is how I need you to communicate giving this medication, or this is how I need you to explain like where I can find like a new pharmacy, like things like that. And this is just like hugely helpful. So I think that this is really great. And Lauren, I think, you being able to kind of share what it looks like from young kids to kids that are like right on the precipice of transitioning to adult healthcare, like that's really great. I'm so glad that you guys are using this.
Well, I just want to say, I'm so sorry you experienced that. I mean, it just sounds so incredibly painful. And like, I'm just so glad you're in the position now to help other people not have to go through that.
Thanks. And listen, when Tina mentioned Got Transitions was coming, I was like, how can we send this out? Like, can we do like a panel discussion? Can we do many more? Because this is something that really like, it affects, I think, like how it sets the stage for a lot of this stuff. Last night we talked about what it means transitioning into like, gynecological practices and obstetrics. And, we've got a lot of these kids that are showing up in the ER, or like what that meant for me when I like just dropped out of psychiatric care. Like it really does affect so many things, because your health and your healthcare means so much more than just your health. Like it's how you navigate the things that you're going to do. Like, what did that mean when I was in college? Like, and it's so much for all of our kids, but then it's also like you as a parent want your child to be successful and you want them to feel safe. And I think really getting to understand this, like, makes it that much more real. So I think that this is really great.
I agree. Oh, I'm so sorry. I just want to say one thing. We also, just so everyone knows, we see patients who are also socially complex, who might not have any physical or intellectual complexities. And we also see folks who are undocumented, because that's also a population that really gets devastated by transition.
Yeah, Derek mentioned that last night.
Yeah. Go ahead, Derek. Thank you.
Oh, no, Lauren, I was actually going to piggyback on that and ask you, because I think last night we said this is really a subset of individuals that we overlook, right? And I think, and I was saying that perhaps it would be folks like you, Lauren, who actually would be able to identify these individuals beforehand. And I'm glad to hear that you actually do see these folks, because, I mentioned that I came to the US and I was 24 to go to graduate school. And I had, I heard about, you have to have health insurance, so don't get sick, because if it's going to cost you so much. But I took the school's health insurance. It lasted one semester. I just couldn't afford it. I dropped it I remember it was the January I came in, this August, the fall semester. By January, it's the first thing I dropped. I just couldn't afford it anymore. And I just said, I'm not getting sick, and so that's just such a group of folks that we need to make sure. And I wanted two comments I'm trying to solicit. One is from Isabel, because I see you're with the child, and youth special healthcare needs. What sort of resources you think could be available? I'm assuming it's the state agency level that could be there. And then I'd love to also hear from Tina, because in your introduction, you said you're a foster parent. And so that's something that you're on this call, how you're preparing for children who may or may not, be adopted when it's time for them to transition, and how is that going? So Isabel, I don't know if you're in a position to comment just in terms of some of the resources that may be available, and then Tina, if you would feel comfortable. If not, please just feel free to pass.
Okay.
Hi, Derek. Can you hear me?
Yes, Isabel, we can.
Okay. I was just communicating with Jaleesa and Tina that I can see you guys, but I can't see anyone else. I can only see when people present. I contract with PIC, Parent Information
Oh,
Center.
great.
So the state, as it relates to children, youth, and special healthcare needs, we don't provide direct care. We contract to Parent Information Center. Parent Information Center serves as a conduit of information for families so that
Excellent.
they can link them up, as well as encourage them to advocate for their kids as well as themselves within the school systems as far as their IEPs go. So we contract with PIC, provided services to children and youth with special healthcare needs.
I think that's an excellent model. I mean, it's something that, we're working on even here in Maryland too, because I think that's biasly, that's the most effective way to reach the communities. Well, thank you. Yeah.
Under myself, I have the EDDIE program, which is the Early Hearing Detection and Intervention program. We have Shatira Baynard, who is our EDDIE coordinator for Delaware, and then we have Michelle Klinstein, who is the follow-up EDDIE coordinator. And they also contract out with Hands and Voices, Guide by Your Side, and also contract out with PIC to provide learning communities such as this, but specifically with children that have been diagnosed with deaf or hard of hearing. So, and that's at the state level. So we contract out. We don't do the direct service through us, but we utilize PIC as a conduit of information for families and to link them up with the services throughout the state.
Great, thank you.
You're welcome.
Tina, did you want to add anything to the conversation on foster families?
I think Tina, did you unmute Tina Turner? Yes. Do you want to comment?
Hi, yeah, this is a great presentation. This is my first time even hearing about this, and my director, he had sent us an email, was like, I know it's short notice, but if you can jump on, jump on. So I jumped on within 5 minutes. But it's very interesting because I have a boy and he'll be 11 soon. So this is great because here lately he's been getting sick, like he had got the COVID, and he had questions. He didn't get the COVID, but he's getting the shots in the series, and he's always had questions about that. So I'm happy about this program. I'm looking forward.
Great, thank you.
Thank you.
You're welcome.
In terms of my work with foster care and adoption, I think that there is a need to have programs like this, to have this information in the hands of social workers, in the hands of foster parents, but also in the hands of teens and young adults as they transition. As we were talking about last night, though, there is a period that some teens and young adults go through where they kind of feel impervious and maybe that they don't need health insurance. And we talked about our own experiences in college or at that age where we kind of felt like, okay, I can drop my insurance or not really pay attention. So, but still having the information available to them so that when they do need it, it's there, especially for kids that don't have necessarily a family base and, people that they can go to later on to say, how do I do this? Or, now that I do want to make an appointment, how do I do that? Because some of the things I know I take for granted, I have a teen placed with me now who, needs assistance with some of the basic things, or things that I might find basic, calling and making an appointment, you know, keeping track of your medical information, privacy issues, even simple things like they'll ask, like, do you want to, I don't know, they'll ask simple things on forms. And she asked me, like, should I put this or this, or should I do this or this, And so I think having those people and that support when they need it is critical. So I would like to get this presentation out to as many foster organizations and adoptive communities as possible, especially those people that have children with special healthcare needs, for all students, but I mean for all parents and young people, but definitely that population, because I think there is some extra planning you might have to make in terms of, as we said, how you're communicating this with your child, how you're dealing with any coexisting anxieties, diagnosis, etc., as you're doing this. And then also, like, legally, I know, for example, here in Maryland, where I live, you can keep Medicaid as a teen and young adult if you're in foster care, if you are going to school or working or have a disability. So, those would be things that the youth need to talk about and find out about and plan for with their agency or with the state, or, and I'm not sure how it works in Delaware in terms of foster youth, but, there are also some legalities and some things that are unique to foster and adoptive care that might play into it. But I think this presentation, this conversation should happen for everyone, because even if you have a neurotypical child, a child without disabilities, they're still going to have to make this transition. They're still going to have these questions, concerns. They're probably still going to need, some assistance in it. And earlier, I think Lauren had mentioned a form that you go over with students as they're turning, or children as they're turning 18. I think this is the form you were referring to.
Yep, that's the one.
Yes. So for everybody else on the call, this information, Becky, where can they find this information and some of the other resources that you mentioned?
Well, all of this is embedded in this PowerPoint and should be good links. Down here at the bottom, there's that resource center for supported decision making. So that should be able to help. And we have other things, other resources too that I gave you that you can present separately. You don't have to go through the PowerPoint, but there's also the quizzes that they can go into, but this is a readiness assessment for the parent caregivers. So that kind of gives you an idea of where you stand. But like yesterday, Derek mentioned, we need to do this more often than just one time. You need to see how the child is progressing. And any of the forms are excellent, but you can take and use what you need, but the quiz really kind of gives you an idea, because the youth can take the quiz as well. And then the parent can do it. So you can get the app for Got Transition and have all of that information right there for you. So you could double check it. You could just have them, okay, tonight we're going to do this and we're going to look at it, but again, wonderful resources in here. So you would just need to look through them and decide which ones that you would like to use. All of them are great. So if you can use all of them, that's even better. Everybody's such an, so individual that it's hard to figure out what I would say for this person, but this is where you can start with that transition quiz too.
Yeah, and you can just always, I mean, with the age of Google, you've got Transition, take you to their website. You know, that's just the best place to start, because you can get the family toolkit, the provider toolkit. You know, there's so much there. This PowerPoint just puts it all together. So if you keep this handy, those resources are there. But if all else fails, or you just don't have it handy, just go to the Got Transition website, and it's, I think it's easy to navigate, and you know, just go there.
But you can also contact us and we can track down more specifics,
Absolutely.
because it may be
And-
something we need to add.
And if Becky is okay with it, I can make this PowerPoint available to the participants here. And then
Sure.
you'll have the links to all of these resources, or you can go to Got Transition. And I believe that we have it linked on our web page, pickofdell.org, but I will
And
check to make
It'll
sure.
also be on the familyshade.org page. So we'll be doing an organization spotlight and sharing some of the links that Becky has put out to us. And then after this, everyone that has registered will go ahead and send out those links and some of the resources that Becky and Derek have shared.
And Tina, if you can just go back a few slides to the
Sure.
one where you're kind of transitioning between the parent and the peds, the responsibilities, those arrows that go across, just to, you know, keep going back again, going, keep going. Yep, right there. So, you know, just to make the point, I think that's an important slide, because it's in terms of the process again, you know, because we've talked about last night how you have to step back and you have to let the, you know, the young adult make some of these calls, but there are going to be things they just don't know, that as an adult, we have been through it. We may know little tricks of the trade that you have to tell them, you know, and I made the question about, they may be told, you could hear on, so being around, listening in on that conversation, they may be told, oh, we can't get you an appointment for 6 months or something like that, you know, trying to see a specialist. You know, maybe they have a waiting, a system that you get on a wait list, that the young adult may just simply not know, because they may just accept they can't get the appointment. They may need to know, well, what if their doctor calls the specialist? Sometimes that can help, right? So they may not know those little techniques, you know, have your PCP call. So you call back your PCP and say, you know, I called a specialist, but they said I can't be seen for 6 months. And the doctor may say, you know what, no, that's not good enough. Yeah, good point. The difference between brand name and generics. And, you know, so I think that's thing. So what this arrow shows is that eventually you want the young adult to be the leader and you become the consultant, but it's not, doesn't have to be cold turkey. You know, the further, you know, oh, you're on your own, you know, you walk them through it. And I think that's important to see.
Yeah, empowerment. You want them
Yeah.
to be empowered to be able to take care of their own.
Right.
But we know everybody's at different levels at different times. Off, you can still proceed through it and give them more and more of their own.
Yep. And you're teaching them, like I said, those kind of tricks of the trade that only come with experience. And like, you know, they think they know it all, but they really don't, you know. And so, yeah.
We have 2 minutes. I'm going to put the poll, the end poll and the post poll, and the evaluation for today. Please complete those. They're really helpful for us in getting speakers, and also we will share this information with Becky and Derek. And if you have any final questions or comments, please feel free to put them in the chat or unmute and ask them. We're so thankful, Becky and Derek, for you coming, sharing this information, your expertise, your experience, and hopefully we hope to see you in the future at different webinars or events. So I'm going to put the poll up now. If anybody has any questions, please let us know.
Thank you for having us, Tina and Jaleesa. It's we're always learning. I mean, I'm so glad I was on this call to hear from Lauren and that model and Tina and Isabel. So, you know, because then I can take that back too, because I want to make sure that we have that summary in our facility, make sure that's happening, and then I can reach
Yeah.
out to Lauren if they're not, you know, get it going.
I so
we're so glad.
apologize, you guys. This internet is the worst.
Yeah, I'm
My
sorry you're
password
having trouble.
ATP sucks. I
Oh yeah,
apologize,
Lauren
but
mentioned that she's happy to
they are-
collaborate.
Yeah.
they're horrible.
No,
And if
this is
you,
great. We're
want
happy
to
to have
put
you.
your contact information,
Mhm.
Lauren, I don't know if you did previously. And anybody, please share how we can reach you. If you have social media, if you have would like to share your email or phone number, because that is what these learning communities are about, making connections, parents and professionals supporting each other, and really breaking the silos in Delaware, so that children with disabilities, no matter the disability, children with special health care needs and those without, everybody can work towards common solutions together. And we're not all working just in certain areas, and losing information and losing that collaborative spirit that is really how we change things.
Right. And they did put their information in the chat, so I can also share that.
I just grabbed that, Lauren. Thank you. So, yep.
Absolutely.
Yeah, and this is great. I mean, that's really the approach with Family Shade is we're working off some of those national performance measures to make sure that we're coming together collaboratively to work on opening the silos and really just supporting our kids that have those special healthcare needs better. So this was a great top measure for Family Shade is that transitioning to adult healthcare. So yeah, we hope to have you guys again. There's no way that you can share this information and we can't access you. This is good.
And I put the evaluation poll up, and this is specifically for this webinar, whether you thought it was useful, if you thought that that we were good presenters, that kind of feedback, we appreciate it. And then we hope to see you next month. We have a learning community every month, and we also have learning communities specific around the families of children and youth with deaf and hard of hearing. So please check out our event page at pickofdel.org or familyshade.org, and register for those upcoming events.
And for any of our organizations that are on the call, we will be having our second round of our Family Shade mini grant program coming up. So keep a lookout in your emails for that. It is $25,000 mini grant for organizations that are out there doing innovative programs or projects for just like broadening the support of our children and families with special healthcare needs.
In my world, $25,000 is not. There's nothing mini about that.
I'm saying thank you, Derek. Thank you. I'm like,
Right?
$25,000 is nothing to sneeze at. And it is really something that can get some programs off the ground, get some work out there. We're really excited. That's kind of like the other half of the Family Shade program, is that one side is kind of getting out there with our parents and families, broadening the education, making sure that like access to resources like y'all are just like more available. But then that other half is really building the capacity in organizations and programs that are doing the work. And then we can come together with that collective impact. So thank you. The $25,000 is like woo woo. We're very excited to be doing that again. This will be our second year. So just everyone keep a lookout. I'll start sending some stuff out in emails. share with any organizations that are doing that innovative work, that are really looking to build that capacity.
All right, well, have a wonderful day and rest of the week. And look out for the email with the PowerPoint, and let us know if you have any questions. Thank you.
Thank you so
guys.
much, guys.
Thank you.